Okay, we should be live right now. Hopefully you guys can see us on your screen right now. I'm Leon, this is Dr. Oliver. I'm sure you've seen us on some of our videos, right?
I would hope so.
Hopefully if you're here, you've seen our videos. So we thought we'd throw in a live Q&A session with Dr. Oliver. We're gonna answer some questions on back pain and posture mostly, and as well as exercise selection and stuff like that. And let me just tell you real quick how this is gonna work before we get started. First of all, let us know in the comments if you can hear and see us okay right now. Just leave a comment below, I'll look at it after. And now, the way we're gonna do this is we have asked for your submissions, for your questions ahead of time. We emailed you and we received a lot of submissions. But unfortunately, we can't answer all those questions. So we picked like 15 to 20 that we're gonna answer, that Dr. Oliver is gonna answer them. Some of them just weren't appropriate for answering on the video, so we didn't answer them. So we're gonna go through those questions first, and then we're gonna also open it up for live Q&A. So if you have a question, just leave it in the chat. There's a chat in the live stream right now, and then we're gonna go through and maybe answer some of those questions. Probably not gonna answer all of them. We're just gonna pick the best ones or something different from what we answered already. Just be very concise and clear with what you're asking, right? We can't answer certain medical questions, stuff like that. So keep it simple, keep it things that we can answer on air here to help you out and help other people. All right, so, and I'm gonna be answering the question, I'm gonna be calling out the question, and Dr. Oliver is gonna be answering them. How are you feeling, Dr. Oliver?
I'm feeling good. I'm ready to go.
All right, people are saying they can hear us just fine, so that's good. Yeah, so we're gonna get started. As I said, if you want us to answer your question and you haven't submitted it, just do so in the chat throughout this session, okay? But we're gonna get started with some of the submissions, because you guys can still learn from those as well. The first question we're gonna go into comes from Stephen Downing, and he just asks simply, do you have certain sessions with exercises for sciatica?
Sure, it's a good question. We have several videos on sciatica. We have one dedicated to kind of treatment of sciatica, 3 main exercises that we'll do with patients with sciatica. We have another video that actually talks about a little test. It's called a slump test, a sitting test where you extend your leg to see if it's truly sciatica or not. Because it's important to differentiate if you actually have sciatica. Sciatica, in basic terms, is pain that radiates from your low back down and goes past your leg. A lot of people have other pains in their hips and their low back, which they call sciatica, which isn't. But if you watch those videos, you'll see a way to test for it, and then also some exercises you can do if you're dealing with it. One little thing about sciatica, it's really important to monitor things that aggravate it. So if you see any activity or thing you do during the day where you get increased symptoms down your leg, that's something to avoid. And generally, if you can back down on the irritating factors, we generally see patients respond a lot quicker and their symptoms go away. So check out those videos. We have 3 or 4 of them. Just look under Back Intelligence on YouTube and you'll find them.
Okay, let's move on to the next. I'm gonna move on to the next question from Maureen Stone. She asks, is there anything I can do for facet joint problem on the right side?
Sure, well there's a lot you can do for a facet joint. So let's just go over what facets are. So it's your spine, right? So side view of your spine. On the back side, you have the vertebrae where they connect to each other. These are your facet joints. They're where each vertebrae connects to the one below and the one above. So generally, facet-mediated pain is pain that occurs when the facets contact each other or stretch extremely. So most individuals with facet pain will get pain when they go into extension-based activities. So those are types of things to worry about or to kind of avoid. If you're going into an extension-based activity, generally with facet issues, you'll have more pain, so you should avoid those. And then the other thing you want to do is you want to stabilize this area. So you want to do exercise, right? So we do a lot of exercises, basically exercises where you don't actually move this part. So that's why we've talked about a lot, but sit-ups are a terrible exercise for the core and low back. That causes a lot of compression irritation to the discs mainly, but it can irritate the facets too. So look to exercises like a dead bug or planks or variations like that, where you're creating stability in here. The more stability you have, you can offload the pressure from the facet. The problem with facets is you're constantly irritating them, right? Because you're constantly moving. If you can support them with muscles around the area being stronger, you generally will see people have less pain with facet issues.
Okay, nice. Thank you. Okay, we're going to move on to our third question from Susie Carward. It's a long one, so I'll read it out though.
Sure.
Yeah. I had lumbar surgery in March of 2022. Should I be in chronic pain 19 months later? I am in more pain than I was before surgery. I am dealing with numbness, tingling, and lower back pain. It is causing my posture to change, hard to stand erect. Compensation for lower back pain is causing me to be a bit stooped. This is causing upper body issues with numbness, burning, and tingling in my arms and straining muscles in my neck. Is this my new normal? Thank you.
So that's a loaded question. There's a lot to unpack there, but spinal surgeries in general have a mixed bag of results. I mean, some people absolutely need spinal surgeries. Other people get them too frequently, we find out. But we need to really know. Without knowing your specific situation, the question is, well, why is your symptoms worse afterwards? Either the surgery wasn't the proper surgery for you, or something didn't go right as planned there. You know, generally, obviously, after a surgery, you should feel better, not worse. But unfortunately, when it comes to spinal surgeries, we tend to see a high incidence of people being worse afterwards or no better. So it's really advantageous for you to, before surgeries, look to those other methods, whether it be exercise or other stabilizing things. But now that you're in this situation, I would implore you to go find a professional that you can talk to, whether it be a chiropractor like me, a physical therapist, or even another orthopedic, and get their opinion on why you're having these symptoms. Because what you've experienced is your pain increased in your low back, your symptoms increased. Now you're compensating and you're changing the way you move. So now other things are getting affected, your upper back, and you're starting to get some neurological symptoms there as well. So it'd be really behoove you to go see a professional and get a good, thorough evaluation. And, you know, again, chiropractor, physical therapy, just find someone that's good at what they do, and they would hopefully be able to give you a good evaluation and get you back to feeling better.
Okay, good. Okay, we're going to continue here, moving forward into the next question from Simon Decree. From Simon Decree, he asks, can I still do push-ups while I work on my rounded shoulders, or should I put the push-ups on pause until my posture is better?
So I'd say you could still do push-ups. It depends on what else you did, right? So what we tend to see is a lot of people do a lot of chest-type exercise, right? So your chest push-up is going to be more chest. And we tend to see people be rounded forward because their chest is actually tighter, their head's pulled forward. But that doesn't mean you can't do any chest exercise. The question becomes, are you doing enough on the other side? So we tend to see that individuals don't do enough back exercise, whether they be an opening type exercise or row type exercise. So as long as you're doing that type of exercising, probably twice as much the back than the front, we would allow you to still do those. And the other thing you want to look at is when people do push-ups, it's very often they'll get on the ground, and what you'll see with them is they'll tighten up their shoulders. They'll shrug their shoulders and then do the push-up. You want to make sure when you get on the ground, you kind of connect down below and you feel the connection here to keep your shoulders out of it and keep your chest open. The whole key to this is keeping your chest open while you do the exercise. So in my opinion, as long as you're doing that exercise, the push-up in the right way with good postural position, you should be able to do that. And in conjunction with that, you should be doing a lot of back exercises, things to open you up and strengthen your mid-back.
Okay, nice. Okay, we're going to move forward here. Turns out I can't pin those questions, but we'll go through them, the ones that you guys are submitting right now. I'll be able to see them. But yeah, we're going to move forward to the next question. Keith Bettany asks, enjoying your email exercises, but can you discuss some common environmental factors / habits that undo these and maybe the underlying cause of pain? Example, seat height to knee level, slope of seat, poor posture, also pillow thickness and how to measure this for you. There are others like standing every 30 minutes, but the above two are good. Thank you.
So most individuals I see on a daily basis, what's the issue? It's not that they're broken, right? It's what they do all day long. So most individuals have these outside factors that lead to what brings them in my office, right? What's the most common thing I see? Most people sitting on a computer, right? That's all posture ergonomics, right? So it's the position. We tend to see, if you want to look for specifics, we have a bunch of videos on this as well that discuss specific angles, how far the monitor should be and all that, but general basic guidelines for your knees, your hips, and your elbows. If you want to look at those 3 joints, is about 90 to 120 degree angle. So again, you want about 90 to 120 degrees at your elbow, same at your hip, and same at your knee. If you sit in a deeper angle, a closed off angle, especially at your hip, it's going to put more stress on your back. So if you're below 90 degrees, your butt's lower than your knees, that's going to be more stressful. We find this in the car is a very common instance, right? So most people sit in what's called a bucket seat. Your butt is lower than your knees. So if you can tilt that seat pan, get your butt a little higher, it's a lot less stressful on your low back. That's why couches are bad for you, right? Your butt sinks in, and when your butt sinks in, we'll generally see someone's low back because their butt sank in around there. A lot more stress into your low back doing that. So if you can raise your butt or your hip to your knee, you'll see less stress in your low back. So look to those angles. And then you want to look at other things, like you said, sleeping, all right? So you should sleep ideally on your side or your back. You can switch back and forth. You want to avoid the stomach generally just due to the neck and the low back. But if you're sleeping, you want to talk about a pillow thickness. Generally on your side, you want to fill this space, right? You don't want it super thin, so you're here, or super thick, so you're out here. If you switch from side to back, you want something in between. Ideally, we really wouldn't use pillows, but most of us grew up using pillows, so you can't sleep flat. So a little bit of pillow to support your head as well would be key there. So you got to look at the things you do. The most common thing I see is people sitting at computers in poor postures. Again, even if you fix that, even if you go perfect ergonomics, you sit up in good posture, it's still not good for you. That's where those sit-stand desks come in. So just move more. If people moved more, I wouldn't be as busy as I am. So all you got to do is move. And you can follow simple routines. We have a bunch of videos on this that talk about just different posture breaks and things that you can do to change it up. If you can sprinkle in little bits of good things throughout the day in the midst of when you're irritating or abusing the body, you'll feel much better.
Okay, thank you. We also have a specific video on our YouTube channel, the best sleeping positions as well, right? We've done that, so you can check that video. Next question comes from Desmond DeJohn. He asks, I suffer with upper back pain in the region of C5 and C6. I have had x-rays and 2 MRI scans done, but they find nothing. Is there a special exercise program I should follow?
So if he's talking about upper back pain, and generally either he's actually talking about T5 and T6, which would be like your upper back, your C is in your neck. He might be talking about that. Either way, they're both closely related. So if you're having pain in this region or this region, and you've had MRIs, you've had images, typically you're not going to find a whole lot. You might find some minor disc bulging and stuff here and there, but thoracic spine hardly ever. Cervical spine, you do see that. But either way, what you need to determine is what's causing it. And this goes back to the last question, right? It comes down to what people do. Most people sit too much. Most people don't move too much. If people just started to do those things and pay attention and look for the irritating factors, and you can find those and you can eliminate them or modify them, I guarantee most individuals start to feel better. One of the biggest things I do with patients on day one when I meet them is talk to them about the things that could be irritating them before I even touch them. If we can figure those things out, they're going to feel better because they're going to take away the stressors. That's what it comes down to. So working on your upper back, getting it to move better is key with this. So generally most people in their thoracic spine, which is their upper back, doesn't move well. So foam rollers for your upper back, or just working on general postural positions for your head, getting your head back. We have a whole course that talks about a posture correction, posture fix. You can see it goes through a bunch of videos that'll teach you how to move better and then gives you routines to work on. But we have a ton of videos. Again, it's all about making your upper back move better and maintaining a good position with your neck, because it's usually these repeated stresses that cause these symptoms for people.
Yep. Okay, next question from Carol Lee Kalman. Because I use a CPAP machine, sleeping on my back works best. Only problem is that After a few hours, my mid-low back is painful. I get up to walk around, do child pose until it goes away. What exercises should I do to avoid this? I do cat and cow before retiring.
Okay, so sleeping on your back, obviously you have to do that or it's most conducive for using your CPAP machine. So sleeping on your back is generally a good thing, right? So we're generally sleeping in this position, but a lot of individuals, especially if they have an increased arch in their low back right here and they try to go lay down and sleep that way, it tends to tighten up on them. You tend to see them get achy in their low to mid back here. So one little tip you can try just initially, temporarily, is literally just bend your knees and your hips. So get some pillows under your knees and your hips to take the load off. And then what that's going to do is slightly tilt your pelvis a little bit, and it should take some load and stress off your low back. And if you find it comfortable to sleep like that, sleep like that. Generally, it doesn't have to be very high pillow, but experiment. 1 pillow, 2 pillows, that sort of thing. But what you're going to want to do ultimately is strengthen that position. So the best exercise I could tell you to do would be like a dead bug, right? So dead bug, what's the point? Is maintaining a good curve here, not moving, and increasing stability. But you want to work on that. We have a whole video, multiple videos that talk about the dead bug. Take a look at those and see if you can master that exercise. But for now, try getting the knees and legs up. So get a pillow under your legs and see if that helps offload the stress so you're not waking up with that tension in the middle of the night.
Okay. We're going to move on here. Jerry Rice. He's
Football player?
Sorry?
I said the football player?
I don't know. I don't follow football. He asks, I have problems with my posture with forward head. I have tried most of the exercises that have been mentioned by you, but it doesn't seem to work. Is there anything else I can do to help me? I get pain across my back at shoulder level.
All right, so it depends on what's actually going on, right? So it depends how bad your forward head posture is. And it also depends, again, this goes back to the same thing. I'm probably going to bring this up all night, is what people do. You know, you can do every single exercise we tell you to do, and if you continue to go out there and put your head or your body in a position that's going to stress it, it's probably only going to help a little bit or not at all. So you have to determine those irritating factors. That's really the number one thing for people, is figure out what that is, modify those, and then correct it through the exercises. So if you don't correct those and then you just go out and repeat, you know, you do the exercises in the beginning of the day or at the end of the day, and then you go about your day and you just, again, you're sitting at the computer, you're driving a lot, your head's forward, it's not going to get better. Or at a minimum, it's only going to get slightly better. So really, you got to figure that out. And then in that regard, if it's not getting better on its own by doing what you're doing, maybe you should see someone like me. Sometimes people come to see me and I can just get things moving better than they can. That's why I have a job, right? So maybe you need to see a chiro, maybe you need to see a physio and see if you can get a little bit of added relief that you can get you to move and make those exercises just more useful for you in the end.
Yeah, the other thing is like ergonomics, right? Like they should pay attention. Besides exercises, they should really focus on ergonomics. It's like what you're saying, what you do all day. If you're sitting on your computer desk or on your couch in the wrong posture with wrong ergonomics, no matter how much exercise you've done for that forward head, it's not going to help, right? So you got to do both. And also, by the way, in our posture course, we do also talk about ergonomics as well. We have daily habits. So you could check that out. I don't know if you're part of that. We're going to move forward. Joe Lord is asking, I am becoming aware of a sore and stiff neck. I find it hard to turn my head around to the right or left without pain from the top of my spine up into my hair, and another pain down the opposite side to my turn. Sorry. I find it hard to turn my head around to right or left without pain from the top of the spine up into my hair, and another pain down the opposite side to my turn from just behind my ear down my neck. I do use a computer a lot. Is this contributing? I feel I need to oil everything so that my neck loosens up. I assume I'm not damaging anything by trying to extend the movement. Is there anything else I can do?
So first question, yes, most likely due to computer, right? So again, what are you doing? You just said you're at a computer a lot. So I guarantee you that's at least a big chunk of what's going on here. So again, if you can address that, you've got to work, I'm assuming, right? So if you can address that and make some modifications to your ergonomics and your setup, that should help. If you can get a sit-stand desk and you can learn to use it by changing your position frequently, that should help. You should not be pushing into pain, okay? So generally with necks and low backs, I tell patients all the time, it's not no pain, no gain. So if you're moving through a range of motion, let's say there's an exercise, a group of exercises called CARS, it's controlled articular rotations, where we'll have you move your neck through circular rotations. It is crucial you do not feel pain when you do that. So if you're pushing through and cranking through pain as you're extending, trying to break through something, you're not doing any good. In fact, you're making it worse probably because you're firing off the pain receptors. And when you do that, your body's not going to respond favorably to that. It's going to tense up the area more because you're injuring it, if you will. So don't push into the pain. Maybe initially some patients I have them do like just gentle range of motion. This is all they can tolerate. And then over time, as we get them moving better, they can tolerate more. But do not push into pain when it comes to low backs and necks. Just move and continue to move pain-free. If you do that, your body will adapt to it and you should start to feel better. But 100% look at the ergonomics and move more.
Okay, next question here from Joy Pattison. I do my exercises for posture, but after 50 some years of bad posture, I don't really notice it. What are some good tricks to remind me when I'm slouching?
All right, so you've had bad posture your whole life, essentially, right? Very common. A lot of people come to me this way later on in life and they have bad posture. So what do they develop? Neck pain, back pain, all this stuff. And they talk to me about it and they know they have bad posture. They've seen pictures of themselves and they know they look terrible. Their head's forward, they're slunched forward. I always tell them, listen, we're not going to get you to 100% perfect posture. It's not going to happen. It's just not. Over time, we deteriorate and these things happen. But can we make you feel better? Sure. Can we fix that posture to some degree and make it look better? 100%. The problem becomes, like you just said, you forget about it, right? You fall into old habits. You've done this so much over time, over 50 years, you've actually done the bad things. You're not going to erase that in a week, a month, 6 months. It's going to take a while for you to ingrain new habits. It will happen. You just have to be diligent. One thing you can do, because I know a lot of people, like, they'll be reading or they'll be at the computer and 2 hours go by and they forget about it, and then they realize they've been sitting terribly for 2 hours or they've been reading terribly for 2 hours. Then you need some sort of external reminder system. Take your phone, take your watch, set it to buzz at you. Anytime you start an activity where you know your posture is going to be bad, have it buzz at you every 30 minutes. Just buzz and just check in with yourself. You'll see where you're at. You'll correct it. It's going to drive you nuts initially, and you're not going to like it. But as you do it more and more and more, you're going to get more comfortable with it, and you're going to be more apt to do the good posture than the bad posture. That takes time. It's a habit. You got to break an old habit you've had for 50 years and start a new habit. It's not going to happen right away. Just work on it. And then you incorporate those exercises, strengthen those new positions and that new mobility.
Okay, great. Let's move on to the next question here. We got Marilyn Gallagher. She asks, when it comes to exercise, what is the most important advice you would give to someone who has osteoporosis?
Well, so osteoporosis, which most people know, is decreased bone density, right? So over time, we all, to some degree, lose some bone density. Some of us quicker than others, some of us more than others. So if you have decreased bone density, you tend to want to favor weight-bearing exercises. So your body, one of the systems in your body, it naturally increases bone tissue if you put some resistance, some load into it. So you don't want to go crazy with this and be trying to lift things you shouldn't be lifting. But if you can just lightly increase the load on your body, it will increase the stress to the bones in a safe way, which your body should respond to over time, trying to increase bone density. So if we don't do that, it'll continue to wither away. So the simplest exercise you literally could do is go for a walk, grab a couple of weights, 5-10 pounds to start to make sure you feel okay. Depending again on your severity of osteoporosis, you don't want to load really bad osteoporosis. That would be a bad idea, obviously. But you slowly want to increase the load. So holding weights, doing weight-bearing exercises at the gym, very good. Again, do them in a safe, controlled manner. If you need someone to guide you through them, see a good trainer as well. The other thing you want to do with osteoporosis comes what? Increased risk of fracture. So you definitely want to work on balance. Over time, we all lose some sort of balance, right? So we need to feed into that. So simple balance type exercise, whether it be standing on one foot, holding onto a chair, standing on a balance pad, something like that. Work on the balance as well, but work on some resistance type exercises.
Okay, great. Let's go into another question from Lorraine Campbell here. I have developed a lack of balance, making it difficult to walk, and I waddle from side to side. What exercises do you recommend for that?
So again, this really depends on what is causing your balance issues. There's a variety of things that could actually lead to balance issues. So essentially your sense of balance and sense of stability in the world is controlled by different systems in your body. Your vision controls part of it, your inner ear, a big part of it, and then proprioception, which is basically the sensations. Essentially, if I close my eyes, I know my hand's closed right now because of proprioception. My body can sense those things. Same with walking around. You get sensations into your feet. Feeding those is very important. We tend to see a lot of individuals wear a lot of shoes and things like that, and that deadens our sensation a little bit. So simply doing some balance type exercises would be helpful. The most basic exercise you could do is literally go up, stand next to like a chair, make sure you're supported and you hold on to that chair, and just stand on one foot. If you feel really balanced and supported, you can take your hand off, but if you don't, if you're very wobbly for now, stand with a hand on the chair, one finger on a chair so you can feel supported. You also want your knee to slightly be bent. Don't lock it out, just slightly be bent. You should feel your foot moving a little bit. You should feel your body. If you're all over the place, it's too hard. Make it easier. So put your hand back on the chair. The goal should be that you could stand on one leg, slight bend in your knee, not touching anything for 1 minute. If you can do that, make it harder. How are you going to make it harder? Put something under your foot like a labile surface or something that's a little bit less supportive, like a folded up towel. Stand on that. You'll notice that's more difficult to balance. They make exercises where you could stand and you could literally just move your leg out to the side. This leg is just trying to throw off my balance. If I'm all over the place, it's too hard. But again, you want to feed into that system. It takes a while and it takes a lot of repetitions to increase your balance, but you're going to want to do that. But do it in a safe way. Don't do it in a situation where you're just going to stand on one leg, you have nothing around you to support you, just in case there's some other thing that's contributing to your balance issues. And if you're noticing the more wobbling patterns, the other muscles you want to look at are your hips and your glutes. So the side muscles, you can look at clamshell exercises, safe exercise to do on the ground, side lying leg raises, safe exercise. We have videos on all these. Look us up on the YouTube and look for those lateral glute exercises. So try those things, work on the balance, and again, just do that every day. You got to keep feeding that system to improve it. So at least once or twice a day, you should be doing some balance type exercise.
Okay, and if you're joining us late, by the way, make sure if you do want to ask some question, we're going to go through a few questions live that you can submit in the chat. We're about 70% done from the submitted questions, so let's continue here. Next question from Dave Murray. He asks, I've been performing the Posture Fix course exercises, so the course that we offer on our website, exercises and stretches for some time now. When I'm on the last stretch of the shorter follow-along course, wall neck planks and neck activation using resistance band, I'm feeling painful strain on my low back. I might be arching my back during these exercises. What is the proper form?
So 100% you should not feel that in your low back, right? So what are we targeting with those? We're doing those chin tucks with the band, right? So there's one exercise where you put a band around your head, you'll tuck in, you'll pull forward. The other exercise, you chin tuck and you lean against the wall. So you're not looking to target your low back at all in that exercise. If you feel you're straining, you've already answered the question yourself. I think you know what you're doing. You're arching through your back, especially the wall one. So as we tuck into the wall, you're probably pushing your hips really far forward and stressing out your back. As you do that exercise, you want to tuck in and your whole body should move off the wall at the same time. So you don't want to see any arch there. So what I tell patients to do all the time, because I see this all the time, is push your head into the wall to push your body off. Don't try to push your pelvis forward. Don't do that. Push through your head to push your body forward. If it continues to strain your back, it's not a good exercise. There's going to be exercises here and there that don't work for you if you can't figure it out. If you feel strain in your back, don't do it. The other thing you could also do is just by slightly tucking your pelvis or tensing your core, that could take your back out of it a little bit too. So you want to try to do that. So again, you shouldn't be doing it. You're definitely arching through the back. Try to keep it tight core, tight pelvis, and then just work on that position a little better.
Yep. Okay, let's move on. We got next question from Cinda Bonanno. She asks, what are some safe exercises for low back pain if you have spinal stenosis, L4, L5, and spondylolisthesis?
Spondylolisthesis.
If I can say.
So essentially she's talking about is this. So spondylolisthesis is essentially when one vertebrae shifts a little bit forward. There's a variety of reasons for it. I won't even get into it. We have videos on this as well. But if that vertebrae slips forward, these holes where these yellow things on the side, which are your nerves, come out, get smaller, right? So that creates a stenosis on the side, a foraminal stenosis. There's foraminal stenosis on the side, and then in the center there's canal stenosis. So either way, you tend to see those holes close down in extended positions. So as I close back like that, it's going to close it down. If I go forward, those holes get opened more. Now, we don't want to do a ton of forward flexion exercises and stress out the discs. We're not going to do that. But we want to look to avoid extension-based exercises, things where you're pushing your body into extension. The best thing to do would be to learn to stabilize, right? So an exercise like a dead bug, right? We're looking for that neutral curve, tense core. Nothing's happening here. We're not moving through this position. We're tightening our core, moving our legs and our arms away, stabilizing. We're building deeper strength. A plank would be a good exercise as well. You may have to modify that position a little bit. If you're in a little bit of extension in that plank, you may have to slightly tuck that pelvis under to open those holes, right? If you take the pressure off, it should feel better. Again, none of these exercises, if you're doing them, should hurt. If they do, you got to modify your position or just don't do them. So you're looking to stabilize that position, strengthen those deep muscles to offload the pressure because you have that spondy and you have that stenosis. That's there. That is what it is. You need to stabilize it and stop irritating it. And if you can do that, you should see some symptom relief.
Yep. Also, we've mentioned, Dr. Oliver mentioned the dead bug a few times in this session. We do have free videos on our YouTube channel with the dead bug. You can check it out. I think we said that. Also, we have a low back course where we also talk a lot about the variations of dead bugs that one can do. Yes, you can check those out on our website. Next question. Got a couple more, looks like, from the submitted ones. And then we're going to see if we can answer a few other ones from the chat. Okay, next one is from Quinn Juni. He says, my wife is suffering from low back pain toward the pelvic by the right. But despite undergoing various exercises, no signs of change. What can we do?
Okay, difficult, obviously. I can't diagnose anybody without seeing them, taking them through exam, that sort of thing. So I'm not going to do that. But if you've tried the exercises, they're not working, then they're the wrong exercises or they're not being done properly. But if you think you've done those exercises properly, you need new exercises or you need to see someone else, right? So maybe you need someone to just evaluate you, right? Maybe you don't need to go through a whole course of chiropractic care or a whole course of physical therapy, but you probably need someone to give you some guidance here, right? So what we're trying to do, but to diagnose a specific one-off condition, it's very difficult. We can give you basics for back pain, neck pain, that sort of thing. But if you have a specific thing that's not responding to the things we've told you, then there might be something else going on, or maybe you need a little system. Maybe you need some soft tissue work. Maybe you need some adjusting through chiropractic. Maybe you just need someone else to take a look at you to see and get you kind of over that hump where you can get back to those types of exercises you're doing to improve, right? So look at that or try other exercises. But the key, any exercise you do should not make you worse, and if it does, it's not a good exercise. And if you consistently can't find any exercises that are good, then you need to get evaluated by someone else.
Okay. All right, let's move on here. We got a question from Summer Edwards. He says, I'm in good shape for 78, exercise daily, and used to be a yoga teacher, but now I do all different types of exercises. I'm a vegan 44 years now, so I eat really healthy and take supplements. Recently, my blood test showed osteopenia, and I have a thoracic kyphosis. I try to keep my upper back as open as possible since my upper back and neck give me discomfort on a daily basis. Any advice would be great. I also started lifting small weights since I was reading about that online.
So I would applaud you for being so active into 78, but maybe you just need to supplement like you just started doing with some other things. We just talked about it before with the osteoporosis, right? And the osteopenia is just a lesser form of osteoporosis. So you just crossed the threshold where now you're seeing some decreased bone density. Again, not alarming, but something to pay attention to. And part of this is genetics, right? So no matter how active certain individuals are and what they do, a lot of individuals will get this, and that is okay. It's just to what degree they get it and what they do about it. So you've done a lot of mobility work, you've done a lot of the yoga, which is great. Keep doing all that, but you should definitely add resistance type exercises. Start working with those lighter weights, increasing the load on those bones in a safe way like we talked about before should help increase or maintain bone density. And then on the upper back and neck, again, some of that is posture related for people, and working on opening the upper back is crucial. So anytime someone's dealing with upper back and neck tension like that, key is working on extension-based activities, whether it be chin tucks, getting on a foam roller for your thoracic spine, and then, we'll go back to it again, looking at things you're doing that are probably irritating your situation, whether it be a computer, whether it be driving, whether it be reading, whether it be sitting on the couch, all those things that put us in that forward head posture. Those are probably things you may not have figured out how to fix, so look at all those.
Okay, and we're gonna do the last submitted question here. From Carol Rushing, how to deal with back pain after an ankle replacement or any surgery?
Okay. So the question becomes, did you have pain before the surgery or did it just come after? Surgeries, especially an ankle or a lower extremity surgery, is going to limit your mobility, right? It's going to stop you from being able to do as much stuff, but it shouldn't stop you from doing things. You'll tend to see individuals a lot of times after a surgery like that not really do much and just try to recover. Yeah, I agree, you got to recover, but the human body responds best and heals best with movement, safe movement. Now, you don't want to do anything that would be loading up the ankle depending on what the surgery was. Again, you may be able to do more than someone that had a replacement or simple tendon repair or something. You may be in a boot, okay? Ideally not too long because you'll see a lot of muscle atrophy over time in boots. So hopefully you're getting out of that quickly. Hopefully you're getting some PT for the ankle. But when you're walking around or you're weight bearing, what are you going to do? You're going to compensate. You're going to shift your position away from that ankle because it's injured and healing. That's okay. So you should probably focus on more non-weight bearing exercises. So go to the floor. Do exercises like dead bugs. You could do bird dogs. You could do probably some side bridging. So you're using from your knees and your forearm. Maybe you're doing planks off your knees. You're not doing them off your toes so you don't stress your ankle. You want to do those things. You want to look at if you're just general back tension, you should be able to get away with cat-cow, stretching. You should be able to use a ball, soft tissue. There's a variety of things you should still be able to do. Just because you had the ankle surgery doesn't mean you shouldn't be able to do anything. And yeah, you want to recover the ankle, but you want to move. You want to get your body moving. So do anything you can do that doesn't hurt or put too much stress in the ankle, and make sure you're getting good rehab for that ankle.
Okay, yeah, thank you for submitting your questions. I think that was it for the submitted questions. There's not too many live submitted questions. There's just a few maybe we can try to answer right now. I'm just gonna read some of them. You can see which ones you want to answer. If you don't want to, if Dr. Oliver doesn't want to answer that, he'll let you know. Let me see here. So there's one here from Dizzy P. I guess that's the YouTube name. I have been dealing with sciatica for 4 years now. Every day I have pain and I can't get the numbness out of my foot and leg. Any tips to help me get back to normal?
So again, depends on what's causing this, right? So if you have the diagnosis, you can see, let's say on an MRI, you see a herniation or a protruding disc or something that's impinging that nerve root that follows the pathway of your pain. That's one story. A lot of people don't have that. A lot of people get an MRI and they'll see stuff, right? They'll see a bulging herniated disc, but it doesn't really match up to where they feel their pain. If you're feeling a specific nerve root pain, then you got to look at certain exercises that try to decrease that, right? So there's a variety of things. You'll look at like a McKenzie set of exercises, which I'm assuming 4 years in, someone's told you to do at this point, which is basically on the ground, pushing forward to arch your back. Again, you want to make sure any type of exercise when you're dealing with sciatica does not increase your symptoms. If it does at all, especially the leg symptoms, you don't do it. It's not good for you. And I would be hopeful that you, 4 years in, you've sought the help of other individuals. Again, if you've seen one chiro or one PT or a couple, you may just need to find the right one that can give you the exercises that will get you out of this. Because unless there's a problem where that disc is impinging that nerve and it's not letting go, then you should be able to get some symptom relief. A lot of people, again, come down to what? It's what they're doing. It's the positions they're putting themselves in. They continue to work and they continue to sit. And if you fall into this category, you got to look at those factors. And if you can get a sit-stand desk or just modify your position, hopefully you'll see some change. But if you don't, then you need to seek the help of someone that can guide you in the right direction with that.
Okay. Now there is a question here. It's a little bit off topic, but you might be able to help this guy out. He says, Antonio Rodriguez says, I'm 15 years old and I'm really interested in chiropractic. Do you know the educational plan that usually goes into chiropractic career?
Sure. I mean, I can tell you what I did, right? So I went to undergrad school. I was pre-med for what I was going to do. I knew I was going to go to chiropractic school to get all my prerequisite. And then I applied to chiropractic school, and I went to chiropractic school for 4 years. So I did my undergrad 4 years. I did chiropractic school for 4 years. And then afterwards, there's a preceptor program. So you work with another doc for a bit. And then you're either on your own or you go work for someone else. So I do suggest people go work for someone else if you get to that point, get some learning under you, and it takes a little bit of stress off it. But ultimately, that's the process. It is intensive, right? So there's a lot of education, a lot of years of schooling. But in my opinion, it's worth it. It's probably the greatest job I think you could have. I get to help people all day long, make them feel better. So it's pretty rewarding to me.
Okay. Wow, 15-year-old who knows what he wants to do.
That's impressive.
Well, I was thinking, I thought I wanted to be an actor when I was 15. Well, I kind of became an actor.
Close.
All right, let's see here. What else? A few more here. Nick is asking how to rehab chronic shoulder pain impingement on the left side. Range of motion is good and done numerous modalities and rehab program. I noticed a weak rotator muscle with front shoulder impingement. We definitely have some videos on shoulder impingement.
We have videos on that. We have videos on exercises you can do. And, a lot of it, again, I keep harping on this because I do it all day long with patients, but it comes down to what you guys do. If you're rehabbing it, you're doing the stretches, you're doing the soft tissue work, and it's just keeps flaring up on you and coming back, there's a reason for that, right? Generally, the reason is something you do irritates it. Again, it can be something simple as the way you sit in your car with your arm. And it doesn't hurt when you're doing it, but if you add up over time, over weeks and months, and then again, boom, it's flared up. What the heck's going on? I didn't do anything. I see it all the time. So it's most likely something there that you're doing that's irritating it. Because studies show we don't need all our rotator cuff muscles. They've done studies where they take 100 people that have no shoulder pain at all, and they take MRIs of the shoulder, and they see rotator cuff tears all over the place. So we know people can live pain-free without rotator cuffs. Depending on the type of impingement you have, if it's really a structural problem, that might be a different story. You might want to look into a form of hanging. It's a type of modality and treatment that many people are doing. You can look it up. I'm sure there's tons of videos on that as well, where people go into hanging postures to try to open up the shoulders. Again, you got to be really safe and careful with that. None of it should increase the pain in your shoulder, but it's just another avenue, a way to treat that.
Yep. And then we have, let's try one. I'm not sure about this one from Dev. We'll skip the first question. The second question he asked, what are permanent restriction lifting weights after multi-level back fusion? So he's asking, what kind of restrictions would you give someone who has fusion L4, L5, L5, S1?
Sure, it depends on how far out from surgery you are, right? So how much rehab have you undergone? If you're a few years out of that surgery and you're rehabbed and there's no issue of risking damage to that, you're not going to have a ton of restrictions from in my standpoint. Wouldn't want you loading your back super heavy, but you should have gone through a ton of core stabilization and activation drills. But ultimately, you could start to activate and strengthen your legs through squatting techniques and that sort of thing. What happens when you have a fusion, you just don't move through your spine as much, right? You can't move those vertebrae. You have to be careful that the vertebrae above and below, they're going to compensate for that lack of movement, that you don't start to stress those too much. So the key, and it's crucial, is working on just general stability through your core, especially if you're going to do any loaded exercises. So if you're going to get into squatting eventually, or things like that, or even deadlifting and stuff like that, as long as you're able to and you're cleared to do that, you got to be conscious that your position is key. So seeing a trainer or having someone guide you through that, I think, is crucial. But generally, again, if you get to the good point after surgery and you're feeling well and you're not stressing it, you should be able to do the things that your doc has allowed you to do and progress from there.
Okay, and let's do the last question. I already know the answer for this, but MTMT asks, do you recommend back brace posture corrector for forward head posture?
No. The simple, you see these back braces all the time. They're on social media and they pop up. They kind of wrap around your shoulders. They X on your back. They put you in a good posture, right? Good posture. The problem with this is you're not doing anything to get there other than putting the thing on. So you put yourself in that brace, and yes, it will put your shoulders back. It'll generally put you in a better postural position. But what's going to happen is you're actually going to shut off certain postural muscles. Your body's smart. It's going to conserve energy at all costs. If you put a brace on, whether it be up there in your low back, and you wear it constantly, you're actually going to weaken muscles because you didn't do a thing to get to that position other than put that on. And that's the last thing you want to do, is weaken those postural muscles. Now, I do believe that if you got one of those and you put it on as a reminder system or as a way to indicate, okay, this is what I should be feeling, and then you took it off after a short period of time and worked on maintaining that position, I'm all for that. But do not wear this thing 6 to 8 hours a day while you're sitting at a computer. It's going to make you worse in the end. It seems like it's going to help you, but it's not going to help you. In the end, it's going to hurt.
Okay, thank you. Yeah, I think that's it for today in terms of the questions.
All right,
I think we're going to end it right here.
I hope you guys learned something. If you have more questions, submit it to us. Maybe we'll do more of these in the future if this is a good response. So just, yeah, I'm happy to do it. And again, send us in the questions you want. We have tons of videos and good courses for you guys too on posture, low back, everything. So
Yeah.
there you go.
Awesome. Yeah. Thank you for answering the questions.
Yeah.
Thank you guys for being with us on the live. Maybe you're watching it after the recording. I do want to make one quick announcement. We used to close doors on our courses, so they weren't open all the time. And recently we've opened doors to the enrollment for both of our premium online courses. One is called the Complete Posture Fix. One is called the Complete Low Back Fix. So check us out on our website if you want to read more about those two programs. They're very detailed, and we put everything into them to help you either fix your posture or deal with low back pain. So doors are open to enrollment on those courses right now, so you can get them at any time, yes? Yeah, and also check out our free resources on our website as well as all the free videos on our YouTube channel. Like we mentioned, we have tons of stuff for you there. Yes? Thank you guys for joining us, and have a good rest of your night.
See you guys.
Let me just turn it off.